This is Dr. Evangelos Bibidakis. Did I say it right?
Yes.
And I haven't seen you in a long time. It's been almost a year.
I would say probably close to 8 months. That was when we had our last meeting here, and we went over different aspects of our practice at ACMC. Today we're here to discuss about the new stuff that are coming up, what new we have, and what's planned for the next few months or even years at the ACMC.
Now, for the people that might have missed your original appearance, tell us a little bit about your background.
Okay.
That sort of stuff. And what kind of practice you have.
Yeah, I'm a general surgeon with a special interest in surgical oncology. Oncology is the part of the surgery that has to deal with cancer. In addition to that, I deal with minimally invasive techniques that use small holes and fine endoscopes, high technology that we can treat diseases in the abdomen, or now will present diseases in the chest. The latest word of technology, and we're able to treat advanced disease, difficult diseases which were considered incurable in the past. So with the least possible pain, with the most advanced techniques, we can offer more treatments to this county.
Now, let me ask you this, Doc. So far, you've been here at the ACMC for several months now. How's it been going there?
Well, ACMC is an interesting place. When I first accepted the job, I was thinking about the new environment and what I had to deal. I'm coming from a big hospital. I was trained in a university setting in Philadelphia, and then I practiced for several years back in Athens. And I was coming in a smaller scale hospital, but with a lot of resources available. So I thought that was a good opportunity for me to start expand the fields of practice and also provide alternatives to the people of the Ashtabula County. So we started expanding the oncology program, me with the other 2 surgeons and all the personnel in the hospital. The administration was very supportive, and here we have the new treatments, the new studies that we can do at ACMC, and things that people probably do not know, and sometimes may think it's a small county hospital. For the big stuff, we gotta go to a big city, but that's not true. Now we're gonna discuss and expand our practice and show what other things we can do to some people who are related to the surgical field. May sound unbelievable, but the bottom line is, come to ACMC and you're gonna see significant, impressive things being done, as I will explain. So when I got the job, as I said, at ACMC, I was thinking, what are you going to do? The first few months, we started doing more and more procedures. Laparoscopies, which means surgeries in the abdomen. Patients who have been even turned down by big hospitals, we devoted time, we did complex procedures, and now they are out in the community as witness of these devotion that we have to the patient, the expertise, and the upscale instrumentation and devices and all the necessary equipment needed for this kind of procedures and surgeries.
So, since you started, since we last were together, you've seen some major changes.
Oh yeah. Let me give you an example. They have a significant renovation of the radiology suite. Now we can do, for example, you know that one of the major killers for women is the breast cancer. We can do stereotactic breast biopsies just with a small incision. If a woman presents with even a non-palpable lesion on her breast and there's concern about being malignant, what I have to do incision, it's a small nick, a little bit of local anesthetic, outpatient procedure, and you get a minimal sample of that tissue, and you know if it's malignant or not to proceed with further treatment. In addition to that, there are advanced high-resolution mammograms that can be done at the ACMC now, and you can even detect minuscule lesions in a matter of seconds. So high-level diagnostics, high-level intervention, high-level treatment in order to obtain the cure of the disease.
There's an American actress, but you might not be aware of her, by the name of Valerie Harper. She played Rhoda on the Mary Tyler Moore Show in the States here. And she was diagnosed back in January with terminal brain cancer. And they gave her 3 months to live. She's now been on the talk shows talking about living life day to day. There's nothing they can do for a situation like that?
Well, the brain tumors are a difficult situation. I gotta explain this in a more in simple terms. For example, most of the tumors are divided into benign or malignant based on their tendency to leave their initial place and metastasize, leave and go into a different spot. In the skull cavity, in the brain, even benign tumors have the potential of malignancy because of the limited space. So imagine if some tumor has also the potential of infiltrating and destroying neighboring structures, how bad it is. And plus, if it's on liver, if you have a tumor in the liver, you cut half of the liver. If it's in the pancreas, you do a pancreatectomy, difficult organ. If you go to the brain and remove half of the brain, then you lose major functions. So you're going to have a patient who may be potentially alive, but not functional.
I see.
So things are even worse. But I would say brain is a very difficult situation, even if it's a primary tumor or it's a metastatic. The other thing is, in order to get an idea of what's going on, usually the tumor is far more advanced compared to other organs. For example, if you have a tumor in the large bowel, you got to reach a size of like 3 or 4 centimeters in order to give symptoms or start bleeding. But on the brain, even a few millimeters, if it compresses a vital structure and you start having paralysis or something else, it's lethal and difficult to manage.
That explains it, and I never looked at it that way because the inside the human skull is a very small area, like you say, and I never thought of that.
Yeah, it's a very small area, limited, and it's also the access to that. In order to go, you got to go through, if it's in the center of the brain, you got to go through major tissues. So our process of going, you cause some iatrogenic injury to reach to the point of the tumor. So even the tumor has infiltrated vital structures, and then the injury is like major there. So the new techniques that they use now is what's called the gamma knife, where they have very fine rays, let's say small beams of radiation that they can be focused from different directions, so you minimize the peripheral injury and everything is focused on the center where the tumor is, and you may destroy the tumor. They are highly effective. A lot of things need to be done in order to be these tumors be completely cured.
That being said, I guess what is new that is, let's take this call because it could be for you on this particular subject. Hi, you're on the air.
Yeah, Pat, my brother died of brain tumor.
Your brother died of brain tumor?
Yeah. I'm the one that called you up and said I had to fly outside outside.
Oh, yeah, yeah.
Yeah, he had inoperable brain tumor.
Inoperable brain tumor.
Yeah.
And he was in the Korean War.
How old was he?
74.
74?
No, 64.
64.
Yeah.
Relatively young.
Yeah.
Well, yeah, it's a difficult situation, and most of the times, not many things can be done. Even the country that has the higher percentage of brain tumors and have developed the most sophisticated techniques, that's, I think, Sweden. Sweden has the highest rate in Europe of brain tumors. Still, they have a high mortality rate. It's a very lethal tumor. But that's not the case with everything else in body. It's good that brain tumors represent only a small minority of the total cancer cases. So I would say, yeah, it's lethal, but thanks God it's only a few cases per year.
Well, I've had 3 brother-in-laws die of cancer.
But they were not all brain tumors, weren't
No,
they?
one was in his bones, one was in his backbone, one was in his leg, and my brother died of it in his brain.
Uh-huh.
And it just, I think it's just, it goes, I don't know. I really don't.
Where sometimes there is what's called, it has to do with the vulnerability of our genes, the oncogenes, that make certain people more susceptible. And for certain diseases, now the tumors that you described, there is no known connection from the literature, but for other ones like the breast, the ovaries, and the colon, the large bowel, there is connection that nowadays with sophisticated tests we can determine which one may be more prone to develop these type of tumors and have a close surveillance of these type of people.
Yeah, that's probably true, but I know my brother-in-law, Tony, he got it in his backbone and then it went up to his, or vice versa. I think it started in his lung, and he never smoked or drank at all in his life.
Mm-hmm.
He was an outdoor hunter, and he didn't want to get around anybody who smoked or anything like that. He was, and then my brother-in-law, Dick, his developed in his leg, and they kept saying it was arthritis. And by the time they found it, it was entirely too late.
Mm-hmm.
So I think cancer is one of those things that unfortunately is not detected fast enough.
Mm-hmm. Okay, thank you for the call. Appreciate your comments.
Did you agree, Doc, or not?
I'm sorry?
Do you agree?
Oh yeah, I agree. But you are unfortunate to have one of the 2 worst cases, like a metastatic in your family, a metastatic lung cancer, and probably the other was a sarcoma. Both are very big tumors.
It's just something that's not easily detected, right?
Yes, that's that's partially true.
Yeah. Thank you.
Thank you. Bye-bye. Head and neck surgery.
Oh yeah.
Big
Now-
developments in that area?
Yeah.
Okay.
Well, this is relatively new to ACMC. We know that a lot of people tend to overconsume alcohol, or sometimes chew smoke, or smoke cigarettes or cigars. These patients are more prone to development of laryngeal cancer or oral cancer, and nowadays thyroid problems that are located in the neck are coming more and more to the surgical clinic. So we can do with the least invasive techniques, thyroidectomies, neck exploration, lymph node removal, and all the associated problems can be treated very well at the ACMC. It's me who's doing general head and neck surgery, and we have a very good doctor, ear, nose, and throat doctor, Dr. Papsidero. We both do head and neck surgery, and there's no reason for somebody to leave the area and go in a bigger hospital to get from the simple procedure of a thyroidectomy to a more extensive, like lymph node dissection or radical neck dissection. He can have, or she can have, these procedures at Ashtabula County Medical Center.
Excellent. Boy, things have changed within the last 6 months, 7 months. Yeah.
Yeah.
Now, do you operate out of Ashtabula. You have an office there,
Yes.
Monday through Friday?
Yes, this is the Ashtabula clinic. On the third floor is the Department of Surgery, where we have a lot of specialties, ancillary personnel. Even if somebody doesn't know if we can help me, he can help him. He can get over to the clinic. He will get the professional advice, and then he can decide, or we can discuss extensively the problem and explain the alternatives that he has. There are also other specialties that assist a lot. For example, medical oncology. Now we have cooperation with radiation oncology, so you have a multidisciplinary team that focuses on cancer.
Now, you mentioned new procedures, Doc. Preferable over the old methods?
Oh yeah. Now the lady who called us before mentioned that her brother had lung cancer, or her brother-in-law. One thing that's important is this type of problem is #1 killer in the United States, lung disease. We have very good pulmonary doctors, and also we started doing these new techniques. One is the thoracoscopy. The old days, in order to get access to the lung, you needed to do a big incision between the ribs, or sometimes for the heart, splitting the breastbone. Nowadays, we can do 3 or 2 small incisions, get access to the thoracic cavity, and be able to resect part of the lung, get biopsies, clean up infections, and even get lymph nodes from the mediastinum or the fiber that covers the lung in order to detect, diagnose, and even treat diseases. That means less time in the hospital, less pain, and much better possibility of early detection and cure.
Now, down the road, what do you see for the future of ACMC?
Well, I see with the support that we have, I would say after we sit as a surgical team and we discuss what else we need to make further steps, we have the administration that's very supportive. They give us more stuff, and there's a foundation that supports us as well. I see expanding our techniques to other fields. So we're going to be able to do more sophisticated procedures, even in the abdomen, the chest, and we're in the process of hiring another vascular surgeon, which will explain more complex procedures. Let me give you an example. It was about 2 or 3 weeks ago that we had a patient who couldn't swallow anything. He had a major esophageal problem. So we were able at ACMC to take his stomach, make a new swallowing tube, bring it up to the neck, and anastomose it essentially to his mouth.
You're kidding?
Yeah. This procedure, I think there's only one surgeon who's doing this procedure at Cleveland Clinic. So you imagine what a major breakthrough was that based on the past and what we can do now. This is not a procedure that has indication for everybody, or it's being done rarely. But you can see, you can have an idea of what we can do now at the ACMC.
That's amazing.
It's called transhiatal esophagectomy. It was pioneered by a major surgeon at the University of Michigan. I would say there is only 1 or 2 surgeons per big university hospital who may be attempting this procedure. Yeah, and the patient is doing well.
Excellent.
Yeah.
That's a good story. It's a good story. Do you live with your family in Ashtabula County?
Yeah.
You do?
Yes.
Have you adapted? Has the family adapted to this?
Oh yeah, that was a major issue that I was concerned when my family got here. My kids, I have 5 children, they got in the area for about 6 or 8 months ago. It was in August. And at the beginning...
What's the age group here?
I have from 18 years, 17 years old, the oldest, down to 9 years old.
Oh, okay.
Yeah. So we have students in different schools of education. I have to give an advice to the parents. If you stay close to your children, keep in touch with their teachers, and you positively reinforce your children, they can do amazing things. And I have an idea of the different systems in Europe and here, I would say the system is very supportive for the student. They need only minimal try to be successful. And I'm impressed how my children, being in this society for like 6 or 8 months, and they are doing outstandingly well. Like the oldest got accepted at a college in Cleveland, and the other ones are doing very well. The third one took part in there is a Mathematics Society of America, and I'm impressed how they do. And it's only the support and staying close to the children, have this close contact with the teachers. So if you don't forsake them, I think the results are very well. And this is like an advice to every parent who has children in the school system.
And I think that's a good tip. I think that parents should be, especially in this day and age, watching over the young ones out there. So you're adapting well then with your new life here in America. They like the rural setting that we have here.
Yeah, they love it, and kind of like they are in the process. At the beginning, we're kind of hesitant of getting new friends. Gradually, they are adapted. They participate in the new situation. They get the benefits of the new laws in society. For example, in Greece, you are not allowed to drive if you don't complete your 18th year of age. Over here, over here, it's unbelievable for them, the fact that you can start having your permit at 15 and a half years old, and that gives them more responsibility. They start like being more independent, and I think if you are supportive and at the same time keep an eye on them, they are very successful. They are doing very well. I'm impressed how they had that.
I've never been to Greece, obviously, but I would imagine it's pretty hectic over there, traffic-wise, that sort of stuff, which you don't see in a small-town area setting. Completely different, you know. I wanted to mention, too, Elaine had given me this information. You have something coming up called the Dinner with a Doc?
Yes.
When's that going to be?
On Thursday, April the 25th. Whoever wants to sign up, there's a number. It's available here, and I'll give it now if it's okay.
Sure.
You can call at Ashtabula County Medical Center, or you can call the number at 997-6555. I'm going to say it again, 997-6555. And you can sign up for the Dinner with a Doctor. We present different topics.
Have you ever done this before?
No, I haven't done it, but I've attended other ones.
So you sit down and have dinner with the people
Yes.
that sign up.
Yes. And we discuss whatever topic they want. I make a short presentation. I've seen other doctors doing it, actually. And we give a short presentation. It will be regarding hernias, wall defects, and problems that can be repaired laparoscopically. And they can ask questions regarding surgical problems, new procedures, and I'm free to be asked even more complex questions. Wherever is in my field of practice, we will start discussing it and explaining to the extent that I can.
I'm sorry, Doc, I don't know where this is at.
This is going to happen at the I think it's at the ACMC. They have a special area which
Right at the hospital itself?
Yes.
Okay. That is going to be, it starts at 6 p.m. and it's only $15 per person. You get a dinner and plus a chance to talk to Doc and ask questions. And from what I understand, it's very popular and successful. It's a good idea. Whoever put that together, it's a good idea. Now, if you want to talk to Dr. Bibidakis, you can call for an appointment, right, at 997-6960.
Yes, this is our clinic number, and you can talk with my nurse and the secretary that we have at the Department of Surgery, and you're going to be directed to the appropriate person. And you can ask for me. I will be more than happy to help you. Even people who have some difficulty with the hours, we can stretch our schedule, and our appointment slots will always can find spaces for whoever wants a special time or has any kind of problem.
Excellent, excellent. Always a pleasure talking to you, Doctor, when you come in. And I appreciate the fact of how you explained the brain cancer situation with that movie actress, television actress, which I had never thought of, and you did it in a very understandable way, and I appreciate that, because it's been on my mind ever since I got word of this terrible, tragic thing that's going on in her life. She's handling it very well, but still, it's a very, very traumatic story, and I appreciate that. We don't wish you well, wish your family well. I hope you enjoy your stay here in Ashtabula County. Always good to have you on. Don't be a stranger now. Come back and see me soon.
Oh, yeah, yeah. It's a great pleasure to be here with you, discuss topics, and if our viewers or whoever watches your the County TV and has questions, they can send you the questions, and I'll be more than happy to answer them.
I will send them to you, okay? And send them to me, and I will then send them to you.
And if you want to have a direct contact with us, come to the clinic. We'll be more than happy to help you. Plus, one thing that I want to mention, and coming from what you just said, is all of our patients that go for surgery or any kind of intervention, we try to keep them informed for every stage of the process, because the informed patient, even if sometimes has to deal with major and bad stuff, is the happy patient. Is the patient who understands and participates in making the decisions.
Excellent, excellent stuff. Yeah. Well, I wish you well. Thank you so much.
Thanks a lot.